Number 1. Okay, so from Sally's ABGs, the normal pH range is 7.35 to 7.45, and Sally's was 7.36. So this suggests that our pH is normal. Her carbon dioxide normal range is 4.7 to 6, and hers was 4.8. So again, within normal range. Her oxygen was the normal range is 10 to 13.3, and Sally's was 12 again, which suggests that it was normal. The bicarbonate normal range is 22 to 26, and Sally's was 24, so again within normal range. And BE normal range is -2 to +2, and Sally's was 0. So overall, it shows that Sally's ABGs were all normal. Then if we move on to the chest x-ray, we can see that the trachea was slightly deviated to the left. Her bones, they look okay, although it does look like the shoulder joint hasn't been fused, but again, she has a child, so it's just maybe not happened yet. Her heart looks less than 50% of the thoracic area. It does look like there is some blurriness around like the edges of the heart, especially on the left cardiophrenic angle. Does seem like there's some blunting. And the diaphragm, it does look the diaphragm is slightly flattened. The right side should sit higher than the left. So we could think that there's maybe a wee bit of hyper inflation. The costophrenic angles do look okay. The right one does look a wee bit blurry, but I wouldn't say it's not sharp as the left. Yeah, and then for expansion, I could count 8 anterior ribs and 9 posterior ribs, which again suggests that there could be some hyperinflation due to there being more than 6 anterior ribs. Fields, it does look that throughout the lungs there is some bilateral like lung markings, and some branching opacities, which suggests that there could be some secretions in the lungs. The gastric bubbles present, and the hilia looks normal, and the instruments, it looks like there might be some like ECG leads there. Question number 2. So Sally, age 14, was admitted yesterday due to exacerbation of her cystic fibrosis. She's having difficulty sleeping due to her cough, and this has caused her to be off school for 3 days. Sally is struggling with her airway clearance at home, and this is her 4th admission this year due to her CF. She was diagnosed with CF at 4 weeks old, and she's pancreatic insufficient. Sally lives at home with her mum and dad and her twin sister who doesn't have CF. She used to enjoy doing swimming and exercise, but since she moved school, she doesn't do anything anymore. On examination, Sally is sitting in bed but reluctant to talk to anyone, and she has a news chart score of 2. She has some signs of infection due to her CRP being raised at 15 and her white blood count being 28, again high, with a temperature of 37.5, which is borderline praxia. Yeah, praxia. She also has an increased heart rate of 90, which normal range is usually between 60 and 100, sorry. So this maybe suggests that, well, considering her age, that's pretty high. and she had a blood pressure of 110/80. As said previously, her ABGs were normal, and on auscultation she has some crackles and palpable secretions in the right mid zones. She has had a productive MP3 and a cough. However, she does seem to be suppressing her cough. Don't know if this is due to embarrassment. Not sure. She also has pleuritin sputum. I think that's how you pronounce it. On the chest X-ray, we can see 7 ribs, and also the right diaphragm seems a wee bit higher than normal. Again, another sign of maybe hyperinflation. However, hyperinflation is quite a common thing found in people with CF due to blockages within the airways. However, with Sally's signs and symptoms, she doesn't really show the typical signs of hyperinflation, such as shortness of breath or using like our accessory muscles with a problem list. So that being sputum retention, and within that hoping to help address her cough. She's also doesn't do much exercise, so limited physical activity, and she also does seem a bit disengaged. Question 3. Okay, so referring back to the problem list made in question number 2, so sputum retention being one of them, so we can hear that there's crackles on auscultation on the right mid zone, as well as there being palpable secretions in the right mid zone. And then if we refer back to the chest X-ray, we could see that there was lung markings on either side. However, on the right side, around the border of the heart, we can see that there is probably more lung markings. So, suggestion that these could be secretions due to bronchi being a bit more dilated, allowing more mucus to gather. Also, she has a productive MP3 that there's been a lot of mucus being produced, possibly in that green yellowy colour, a sign of infection, and she's producing quite a lot of it. She's also suppressing her cough, and it may be making her more prone to these infections that she keeps having, if she's not able to do airway clearance properly. And all this mucus is full of bacteria, and it also could be causing her to clear less sputum and exacerbating her sputum retention. One of the other problems was that she wasn't really doing a lot of physical activity. It'd be good to try and get her moving, like round her bedside, which would get the secretions moving and hopefully increase her sputum clearance. And lastly, thought she was maybe a wee bit disengaged. So it'd be good to find a way to get Sally like cooperating more and opening up about maybe her challenges and difficulties and her feelings that she feels towards her CF. Question number 4. So CF is caused by the mutation of a gene, specifically on chromosome number 7, which codes for cystic fibrosis transmembrane conductor regulator, which is important for the transport of chloride and also transports salt and water. So when there is a mutation on the gene, it causes a change in shape of the CFTR transporter, and sometimes it might not even be present at all within the membrane. So when it doesn't work, it causes there to be an increase in the sodium channel, which allows more sodium to enter the cells. Therefore, there's a higher concentration of sodium and chloride ions inside the cells compared to outside, this causing osmosis. Water therefore enters the cell and dries up the mucus, and this causes the mucus to become thick and sticky and then difficult to be swept away by the cilia, and this will cause problems within the lungs and within the digestive system. We can also, so from like referring back to Sally, we can see that she's struggling to clear the mucus from her lungs, so suggests that she could have an increase in this sticky mucus due to her CF. And also we can hear on auscultation that she's having crackles and the palpable secretions as well. Sally also has like multiple like infections or exacerbations, so she might be finding it hard to fight infections, and she's currently taking like nebulizers after her physio, to which are antibiotics. And we can also see from her white blood count being raised and her CRP, as well as like the sputum and her temperature being high. Question number 5. So some psychosocial issues. So modifiable ones is her alcohol and smoking. Like we don't know if she's actually smoking, if she denies it, but this could be damaging her liver, leads to dehydration. She is smoking. It can make her harder to breathe, reduction in her lung function, and also it can paralyze the mucociliary tract. And also people who smoke are more susceptible to infections like chest infections. Exercise in people with cystic fibrosis is really important. Noted that she's disengaged, so she's not performing her airway clearance techniques, and therefore she's just allowing the mucus to build up in her lungs. Also, we notice that she's suppressing her cough. This could be due to embarrassment, or she's not confident, and then she's making her symptoms worse by leaving the secretions down in the lungs, and it's exacerbating her symptoms, and making her more susceptible to infection. Moved school, like she was previously bullied, and she's not doing like she used to do swimming, so she's maybe lost interest in things that she used to enjoy. Non-modifiable psychosocial issues could be that her sister doesn't have CF, so she might struggle to see her sister live a normal life, so she's resentful to her and jealous. Seeing her going out with her friends, or she's having to do physio, and her sister, is just having to can just go out whenever she wants. She's got a lot of structure to her life that not everyone else would have. Also, her parents look like they have pretty busy, stressful jobs, and maybe Sally feels that she can't talk to them about how she feels, or and this is just maybe making her feel a bit isolated and depressed. We also noted that she has just moved school because she was getting bullied, and then she's also, when she's moved to her new school, she has now started drinking and taking alcohol. So this could be just like her being a rebellious teenager, and it could be peer pressures from school, people trying new things, as well as like her hormones changing, causing this to affect her mood and her emotions. Also, people with CF have a life expectancy of 40 years, so that could be lingering over her head, that she's not going to live the life that she probably imagined. Medications, I kind of briefly touched on before, where like her sister is just able to go out and do everything, whereas Sally has like her nebulizers. Like those nebulizers need to be taken 20 minutes before physio, and then she might have to take something an hour after physio, or something after physio. So everything is just quite time consuming, which could probably make Sally feel quite frustrated. Okay, question number 6. So referring to the problem list that was made earlier, sputum retention was one of the priorities. So for this, you'd want to do the airway clearance techniques, such as the active breathing cycle. So it's a set of adaptable breathing exercises which will help loosen the secretions from the lungs, which will help improve the person's ventilation. And also it can help improve the effectiveness of a cough. These are usually done for 10 to 30 minutes. 1 to 2 times a day. However, in Sally's case, due to her exacerbation, she should probably be doing these for 30 minutes, 3 times a day. So the components of the active breathing cycle is breathing control, which helps relax the airways. Then we have thoracic expansion, which is deep breathing exercises focusing on inspiration as well. And then also you've got the huff. So with the huff, these can be done at different levels. So you have a medium huff, which helps move secretions from lower down in the airways. And then you've got a high volume huff, which helps move secretions in the periphery airways. Throughout active breathing cycle, it's important to try and suppress the cough and encourage the patients to wait until the mucus or sputum is just about to come up, or if they're really, really struggling at the very end. Another technique to be done would be autogenic drainage, which is controlled breathing, which aims to maximize expiratory flow from different lung volumes while minimizing airway closure to assist with ventilation and airway clearance. So there's 3 phases to autogenic drainage. You've got loosening secretions, collecting secretions, and evacuating secretions. The other airway clearance is the airway devices. So the one I've chosen is PEP, so positive expiratory pressure. So this involves breathing into a mask with a slightly active expiration against an expiratory resistance. So this causes pressure in the lungs, causing the airways to splint open on expiration, preventing airway obstruction and gas trapping on expiration. Splinting in the airways allows the air to get behind the secretions via the collateral channels of ventilation, and this helps move it from the lungs and from the airway walls, and then into the mouth. Another thing is medication. So we noted that Sally was taking lots of saline and nebulizers. So these are usually performed before she would do any sort of active breathing cycle or before PEP. The saline solution is turned into a mist, which is breathed into the patient, which helps loosen up the mucus in their airways, which then makes it easier for them to cough it up. The psychosocial as well. So you've got her low mood and depression. So you could think about asking her if she wants to talk to someone about it. So maybe there's also some cystic fibrosis support groups where she can maybe talk to people the same age as her. And you've also got the limited physical activity. So while she's in hospital, it'd be a good idea to do some like pulmonary rehab exercises, so like bedside exercises. So these will help loosen up the sputum. Question number 7. So I have chosen PEP. So collateral ventilation. So that's a large inspiratory volume that can facilitate collateral ventilation as when we perform a deep breath. So this allows time for all the air to pass through like all little connecting channels, and then that bypasses the normal airways, which can further be enhanced by a breath hold or a sniff. So that allows them just to get the air to go a bit deeper. Also, like when we were doing our normal breaths, we just choose the easiest route. So these like connecting channels don't always get used because they're blocked off. So this will allow air to get behind those secretions, and then that will help shear them off the airway walls. And it's also useful for like removing secretions while reinflating the collapsed alveoli. So also you've got enhanced respiratory airflow. So if your peak expiratory rate flow is 10% greater than your peak inspiratory rate flow, then you get this energy transfer from the air to the liquid. And then this results in a like shearing effect, moving the secretions from the airway walls, allowing them to mix with the expiratory gas. So the shearing forces also change the property of the mucus. So this can change the viscosity of the mucus, and then it ends up making it easier for us to clear. A study by Maggie McLaughlin, I think that's how you pronounce it, 2019. So she looked at the positive expiratory pressure in physiotherapy for airway clearance in people with cystic fibrosis. And she compared all the different forms of physio to PEP. So she compared autogenic drainage and the flutter and active breathing cycle as well. There was a few others. And as a means of improving like sputum clearance in people with cystic fibrosis. So it looked at patient performance and lung function. So this review showed that there's high evidence that when PEP was used, there was a decrease in exacerbations of people with CF compared to the other types of physiotherapy. It was also important to note that airway clearance is individualised to each person. So you might not give PEP to someone who's maybe got CF, but they maybe have different signs and symptoms. And it also comes down to patient preference as well. So somebody might feel that PEP doesn't work as well for them as maybe autogenic drainage does. So yeah, it's definitely, you have to listen to the patient as well, because they know their body and they know what's maybe working for them and what's not. One other paper that looked at the effects of exercise and airway clearance and the mucus clearance of CF. This was by Dyer 2019 and partners. So they use treadmill running and then PEP as two different clearance techniques. They also had a control group that did nothing at all. And the treadmill cleared significantly more secretions than what PEP did. And the amounts of mucus that was collected was cleared from the middle and peripheral airways when comparing treadmill and PEP. So from that study, it was showing that PEP was more effective than exercise. Question number 8. So short-term goals. So they probably would want to be done within the next, well, some of them within the next treatment. So for example, the active clearance techniques for sputum retention, you want them to be done ASAP. Since she has been struggling with these at home, and it just means that she can take these away, learn them just now, then take these away and do them at home, and before she gets discharged, we'll be able to use auscultation, chest x-rays, sputum samples and palpation to see how effective it's been. Then within the next 24 to 48 hours, you want to make sure that you teach the different techniques to Sally to help with her sputum clearance. So you've got your active breathing cycle, your autogenic drainage, your PEP and your huff. And then on day 3 to 5, you want to just have a review with Sally, just to see how she's getting on with the new physio techniques, and amend any issues or concerns that she might have, just to ensure that she's doing them effectively and correctly. As stated previously, she's had 4 previous admissions due to exacerbation. So while she's in this time, it's probably a priority that she gets these techniques nailed so that it ensures the effectiveness of the physiotherapy just to prevent any more admissions. Then week 2 of admission, you want to try and maybe implement some sort of rehabilitation strategy. So, for example, Sally doesn't do any physical activity. So, work with Sally to try and determine some goals for physical activity. For example, maybe trying to hit 10,000 steps a day. And then long-term goals for like 6 to 8 weeks. You want to maybe get her to go to a follow-up clinic for her cystic fibrosis, just for a discharge review, just to make sure everything's going okay. She's getting okay with her airway clearance techniques. And then you also want to maybe create a long-term plan for physical activity with Sally.